Traumatic events can happen to anyone, and the circumstances of these events can encompass a wide variety of scenarios. Unfortunately, the long-lasting effects of these perils can sometimes cause post-traumatic stress disorder.
Now, we most often associate PTSD with veterans who have experienced combat, but the perils of everyday life can actually cause the disorder to manifest in anyone who has faced severe trauma. Now, since it is PTSD Awareness Month, we would like to bring in Beth Anne Dorman, who's the CEO for All Seasons Behavioral Health and Rape Crisis Center, to clear up some of the misconceptions that maybe you have around PTSD. Thank you so much for talking to us today.
Thanks for having me.
Okay, so before we actually get into the details that we want to ask you about, tell us what PTSD is.
So PTSD is a serious condition that can develop after someone has experienced or witnessed a traumatic event or a life-threatening situation.
And that's something that can come back later to affect them.
Yeah, and I think I appreciate you bringing up that it's not just our veteran community, because we can all experience a traumatic or a life-threatening event, even if we are not in a veteran capacity. And so it's really important that we understand as a community that trauma can happen in our very own communities. And so it's important that we talk about the fact that this really can touch everyone's lives.
So give us some examples of PTSD in just everyday people.
Yeah, sure. So, think about car accidents. Think about maybe potentially someone who has experienced a bank robbery and been in a bank when someone has come in to try to rob the bank. You think about a traumatic fire where someone's life has been at risk. Some of these things can really trigger us into a post-traumatic stress moment. And that's a really important thing to recognize, that it can happen in a most unexpected situation.
So are there symptoms for that moment?
Sure. So, it might be the fight or flight. Our brains are programmed to be able to protect ourselves when we are in fear. And so, there's a difference kind of between sort of the life experience that you've just had a bad day versus post-traumatic stress disorder. And when it perpetuates for number of days and ongoing, that's when the PTSD diagnosis might come in. I always talk about things that I hope people can relate to. And so if you imagine like a mosquito bite, that might be a life event. That might be something where you're paying attention to it in the here and now. It itches when it's, you scratch it, and pretty soon you find a way to let it go away. That might just be an unfortunate life event. PTSD might show up if you could imagine somebody who gets stung by a bee who is allergic to bees. Yeah. And then it becomes something where you need to have either qualified help or something else that really, it's not just something that's annoying, it's something that's perpetual, and we need to make sure that we've got safeguards around. And so I talk about mosquitoes and bees a little bit to help people understand this is just an unfortunate life event over here. This is when we can really think about the effects of PTSD and something that becomes bigger than just an annoyance or something that you get past quickly.
So do you think that PTSD, do we really talk about it enough?
No, absolutely not. When we look at PTSD, we know that 8 to 12% of people will be diagnosed with PTSD. So, let's average it at 10%. So we know that 10% of traumatic events end up with a PTSD diagnosis for folks. The important piece of that, though, is that 90% of that 10% of our population can move through PTSD within 8 months. And that might be by working with a therapist. It might be by doing some resiliency within ourselves. It may be just giving some time to the process. Okay. But we really do need to check in with anyone who has experienced even a simple car accident to say, how are you doing? And making sure that, it might be a week, maybe 2 weeks where someone's struggling a little bit, but if this is going on and impacting our daily life and our ability to complete tasks, go to work, be able to find happiness again, those are the moments where we need to really check in about what was the triggering event that moved someone to this new place.
So where do we get started to try to find some help for PTSD?
Sure. So, you can reach out to agencies like ours. We are accepting new patients and have no wait list. There are some agencies that are right now struggling to get folks in. You can check in with an agency and even just say, this is what I think is happening. And there may be a way that they can even just give you some qualified guidance. You can check in, especially with our children, pediatricians, your doctor's office. Those are the places where we can go and say, here's what's happening. Help me understand what my next steps might be. And you can also look to your local health departments. You can look to the local hospitals and urgent cares and talk through what's happening if you're not able to get in with a mental health provider right away.
Beth Anne Dorman, for all seasons, thank you so much.
Yeah.
Good information
Thank you
there.
so much.
Have a great day.